are at BioEurope 2025 in Vienna, Austria, and I was just moderating a panel on composing the next era of women's health. And I started off the panel by saying, I'd love to have said that for the past 20 years I've been talking about women's health, but I haven't. Because nobody has been, because it's underfunded, under-researched, underserved and underreported in many ways.
There is more innovation that we see coming through research, although research funding has been very limited in this space. So with new innovation, you can see new opportunities that are coming through that are financeable, that address real clinical unmet medical needs. And these are the ones where you can see that the product can make a significant difference in the clinical treatment paradigm.
Particularly with biotechs, it's very exciting for us to see a lot of innovation happening in the space that's been underfunded for so long. And we see a lot of exciting partnerships in the women's health space, but there's also a lot of new organizations and smaller startups coming into the space. And so we are very excited to find any sort of innovation that can help address the needs of the populations we're most focused on.
The Gates Foundation is doing some really groundbreaking work in women's health. It's fantastic to see them come in to help build some of the missing parts of the ecosystem. I think we are at the beginning of the investment community and in general the media and the population recognizing that infertility is an issue in the developed and developing world. So what I hope in reproductive medicine that there are alternatives available for both men and women, that IVF becomes more efficient so fewer cycles are needed to have a baby. So for couples who want to have children, they have the ability to realize that dream.